This is day 1 of 12 to getting you prepped for anatomy and physiology. Today we're going to be doing Unit 1, Introduction to Anatomy and Phys. We're going to talk about the anatomical position, directional terms, body planes, body cavities, body quadrants, and body regions. These are our objectives for today. We're going to define the anatomical position, identify and correctly use directional terms, describe the major body planes and explain how each plane divides the body, locate and describe the major body cavities, identify the 4 abdominal quadrants and the organs found in each, as well as identify the 9 abdominal regions. Before we get started, I want you to know the difference between anatomy, physiology, and pathophysiology. You're taking anatomy and physiology, you need to know the difference between these two terms. Anatomy is a study of the form and structure of an organism, for example, the names and locations of bones, where physiology is the study of the function of the organism and how it actually works. So for example, it's the transmission of nerve impulses from your brain to your eyelids so that you can blink. Pathophysiology is going to be the study of why a disease occurs and how the body actually reacts to it. All of these terms are important when going into anatomy and physiology. The anatomical position, I want you to get this embedded in your brain that the anatomical position is the only position in which you're going to refer to the body. It is a standing position where the body is upright, directly facing forward, feet are flat, and directly facing forward, and the upper limbs are on the body's sides with the palms facing forward. If you need to, I need you to stand up right now and mimic this position. Okay? Unless stated otherwise, we're always going to use or refer to the body in the anatomical position. It is necessary to avoid confusion when organisms take on a different position. So for example, if the patient is laying down prone, supine, in the fetal position, if they're doing a handstand, it doesn't matter what they're doing. We're always going to refer to it in the anatomical position. Now with that, there are certain terms that we use, again, to not be confused when describing different organ, body parts, or structures. The terms that we're going to go over now are going to be your directional terms. These are going to be super important when getting started, again, to avoid confusion. Superior is going to be referred to as something that is up or above, so is up on top or towards the top. Inferior is going to be down or below. Medial, I want you to think of medial as being closer to the midline. The midline is going to be an imaginary line that divides the body in equal left and right sides. So if we're closer to that midline, we're medial. If we're further away from that midline, we're going to be lateral. Anterior is going to refer to in front of or towards the front. Posterior, it's behind or towards the back. Okay, the next two, proximal and distal, these two, I want you to only use them, okay, when we are referring to 2 points on the same limb. The same limb can either be an arm or a leg. All right, these two are going to refer to either being closer or further away from the point of attachment. The point of attachment refers to where a limb or structure connects to the trunk. So for example, the arms here connect at the shoulder, that is the point of attachment here. The legs connect at the hip, that is the point of attachment here. So if we're closer to that point of attachment, we're proximal. If we're further away, we are distal. Okay, the last two is superficial and deep. If we are superficial, we are going to be closer to the surface of the skin. And then if we are deep, we are further away from the surface of the skin. This is a hypothetical geometric planes. We have 3 of them and they're used to divide the body into sections. The frontal plane, okay, here's your frontal plane. It is a vertical reference that divides the body in anterior and posterior portions. Okay, so front and back portions. Next, you have your sagittal plane. This is a vertical reference that divides the body in left and right sides. So we divide the body in left and right side. It's almost like that medial line that we have. So the sagittal plane could be anywhere on the body. If it is directly in the center, we refer to it as the mid-sagittal plane. Lastly, we have the transverse plane. This is a horizontal reference that divides the body into superior and inferior portions, or top and bottom portions. Next, we have body cavities. The body can be divided into regions according to certain cavities that houses each organ. So we have a dorsal cavity and we have a ventral or anterior cavity. In the dorsal cavity, this is found in the posterior or the back part of the body, and we have two main cavities that we can find there. We have the cranial cavity that houses the brain. That's going to be this guy here. And we have the spinovertebral cavity that houses the spinal cord. That's going to be this cavity here. In the anterior cavity, we find these on the anterior portion of the body, and it is subdivided into two cavities separated by the diaphragm. So you have the thoracic cavity, which is the most superior part of the anterior cavity, and you have the abdominal pelvic cavity, which is more on the inferior part of the anterior cavities. The thoracic cavity is going to be this upper part here, and it's actually going to be subdivided into further cavities, but let's not get into too many details. Just know that we have the lungs and the heart as well as large blood vessels housed in this cavity. In the abdominal pelvic cavity, that's divided in the abdominal and pelvic cavity. The abdominal cavity is going to contain the stomach, small intestine, large intestine, liver, gallbladder, pancreas, and spleen, while your pelvic cavity is going to contain the urinary bladder, reproductive organs, and a small portion of the large intestine. Because our abdominal pelvic cavity is so large, we can subdivide it into body regions and body quadrants. The quadrants are going to be 4 identical quadrants that divide the abdominal cavity into the right upper quadrant, right lower quadrant, left upper quadrant, and left lower quadrant. Each of these quadrants are going to have specific organs, so you can identify if a patient has an injury or pain in those sections. You can break it down into what you think might be the issue. In the right upper quadrant, you have the right lobe of the liver, gallbladder, right kidney, and portions of the small and large intestine. In the left upper quadrant, you have your left lobe of the liver, stomach, pancreas, left kidney, spleen, portions of the large and small intestine. In the right lower quadrant, you have the cecum, appendix, portions of the small intestine and large intestine, right ovaries in females, right spermatic cord in males, and right ureter. In the left lower quadrant, most of the small intestine can be found here, portions of the large intestines, left upper ureter, left ovary in females, and left spermatic cord in males. The next part are going to be your 9 regions, which we're going to go into in the next slides. All right, so here are the body regions. This is where we divide the abdominal pelvic cavity into even smaller regions if the quadrants are still too broad when a patient comes in complaining of pain or discomfort. Up at the right, we have the right hypochondriac region that's represented by the letter A. We can find the liver, gallbladder, right kidney, and small intestine. Right in the center at the top, we have the epigastric. Epi means above, gastric means stomach. So top of the stomach, here you find parts of the stomach, the liver, pancreas, duodenum, which is the first part of the small intestine. Okay, moving on to the left hypochondriac region, that's going to be represented by letter C. Here we find the spleen, the stomach, the left kidney, and the tail of the pancreas. Letter D represents the right lumbar region. You have the ascending colon, right kidney, and small intestine. Right in the center, represented by letter E, you have the umbilical, which has the small intestine and transverse colon. Then by letter F, you have the left lumbar region, which it has the descending colon, left kidney, and small intestine. Letter G is the right iliac or inguinal region. We have the appendix, the cecum, and the small intestine. H represents the hypogastric region or the pubic region, and here you find the urinary bladder, small intestine, and reproductive organs in both females and males. And then lastly, letter I, your left iliac or inguinal region. Here you have the sigmoid colon and the small intestine. If you want to continue this series, go ahead and like, share, and subscribe so that tomorrow we can do Unit 2. Thank you guys for being here. I appreciate you. If you have any questions, let me know, and I'll see you on the next one. Bye!